with the state legislatures for over 15 years. I want your listeners to understand that because neither Roberson, Fiore, Tarkanian, Matthews, none of my opponents all put together can say that they've actually worked on healthcare policy legislation for over 15 years. I can. Dr. Annette Teijieiro even recently worked on legislation that protected everybody from having the highest quality professional as an anesthesia provider at the head of their operating room bed.
And people should know you're an anesthesiologist. Those who don't know, that's your specialty.
That's right. I am an anesthesiologist. They also need to understand what that meant, because people like Roberson pushed through unanimously a bill, Senate Bill 181, that was going to introduce a new lower level provider to be at the head of your bed during surgery. These people aren't doctors. They're not nurses.
Wow.
So they were going to come in and they were going to supervise 4 of these individuals. Now the kicker is that there were big corporations. Over the last 4 years, there's been over $250,000 spent on lobbying to get this done for 4 years. More than 4 years, actually, I have fought this process.
So who would have saved money? It would save the insurance company's money to put people who are not as qualified as you?
Oh, no, it wasn't going to be a boom for the insurance companies. What it was going to be a boom for was for crony anesthesiologists that were going to double their income. So if I was a selfish individual, I would have said, sure, go ahead, put these people out there so I can double my income. But it would have lowered the quality. So you would not have had your own anesthesiologist at the head of your bed at all times.
Wow.
So we also have nurse anesthetists, which are highly qualified individuals. They're like nurse practitioners that have had a lot of training, not only through nursing, ICU training, and they've worked in the field and then gone and gotten this, either a master's or a doctorate. But we were going to tone that down to somebody who basically had 4 years of college and maybe 2 years of training. You know, it's pretty extreme.
Well, that's the reason I think it's important to have somebody who does understand medicine.
Exactly.
You know, because obviously you understand it from a different perspective. A lot of politicians will stand up and talk about it, but when it comes right down to it, they really don't know the practical application every single day.
Well, here's the interesting part about that whole thing. The interesting part is that those people that gave that money to Roberson and his cronies were doing it because they saw the payoff. So we have to be careful because we only have 17 physicians in Congress. That's it. This is one of those seats. So we lose this seat to a non-physician, we're down 16 at best. We need people that are healthcare professionals inside of Congress because Congress is deciding to make all kinds of healthcare decisions, both in Medicare, Obamacare, obviously, and our Veterans Administration system.
Right. That's important. That's why you keep saying people need a doctor in the house. The website is friendsforannette.com, friendsforannette.com. Dr. Annette Teijieiro, good to see you, and good luck with your campaign. Always
Thank you. Always fun to talk to you, and I'd love to come back if the listeners have any questions, because I am the most qualified. I am the one who's been here for 4 decades. I am the one who has been a public servant, not a career politician, not a bought and paid for.
Nice to see you.
Nice to see you, Heidi.
Thanks, Marky.